Hi, everybody. So as we were expecting it, Montreal and the CMM is passing in the red zone this week. And as the government has announced yesterday, we have measures that are going to be in place for the next month, trying to flatten the curve and make sure that we are able collectively to protect our health system, to protect our schools and daycare centers, and of course to protect all the vulnerable population that we do not want the virus to attain. Those decisions are difficult decisions because we know that there is a lot of impact for everybody, us and of course the commerce, the workplaces that are affected. And it's going to affect our social life, of course. For Montreal, the epidemiological situation for the last week, we had more than 1,669 cases. It's about 240 cases each day. What we've seen is that all the sectors of Montreal, all their indicators are increasing. So even though we know the West is less affected, we're seeing a tendency, and we have to put those measures for all Montrealers. Of course, by having a lot of community transmission, we also have an increase in the number of outbreaks. Most of our outbreaks in workplace settings, schools, daycare centers, or even in the healthcare facilities are small outbreaks, most of them, and are well controlled at this time. Where we have more difficulty, it's really in the community transmission associated with the social life that is the vector of transmission. So the logic for all those measures that we are asking the population to put in place, it's really to flatten the curve and protect the essential services that are health sector and the education sector, to keep most of the population at work at this time and to protect the vulnerable. I would like to add some specific message. I won't go with around the measures that are announced. I think they were announced yesterday. We're keeping most of our population at work because it is essential. But what we're seeing when we investigate our outbreaks is that the workers are protecting themselves when they are at work with for example, a teacher with their students in the class or in the daycare center, or with colleagues when you're working. But where we see that there is a decrease in the application of the measure, it's around work. When you are in the rest area, in the lunchroom, when you are carpooling, or in social activities around work. Because work is a social activity, it's a work, but it's also part of our social life. And people are going to maintain at work during the next month. But what we're asking is keep your mask and keep your distanciation even at work when you are with your colleagues. We've given some priorities for screening tests last week. So we prioritize people with symptoms, people that have been in contact, or people that have been associated with an outbreak. What I would ask this week is that we add and we promote screening tests for the population of 18 to 34 years old. Because what we see is that we have high positivity rates in this group, but a low proportion of tests in this group at the same time. So that means that we do not capture all the cases and that we are missing cases where we could make an intervention. And of course, right now, because our positivity rates are higher, we're asking people, when you have symptoms or when you're waiting for your result, isolate yourself and start dressing the list of your contacts in the last 28 hours, people you were in contact with, because we are going to ask you to call them and to notify them that they may be at risk. Finally, we had, I was talking last week that we had some difficulty with the collaboration of the population with public health when we are calling. People do not respond, or people do not collaborate with the investigation. We made some progress because we now send letters and people can call us back directly, so we had a progress. But what we are launching today is a social media campaign that is called Public Health is Calling Me. Don't ignore this call. So it's a campaign that's going to be going on in social media for 4 weeks with different messages. We also have healthcare professionals that are going to be talking to youth and young adults in the media, in social media, different platforms, to answer questions and to be part of the discussions to make sure that young adults are also partner with public health to contain this virus. Thank you.